a technique of adding nutrients into damaged tissue to help repair and regenerate tissue. And in some cases it has a regenerative effect, in some cases it has a chemical change effect causing the chemistry to change where people feel improvement. The biggest nutrient that joints are often lacking is oxygen. When tissue swells, oftentimes it lowers the amount of blood that can get to an area, thus causing a local hypoxia. So by adding oxygen or bioavailable oxygen in the form of ozone, you can actually trigger a response. I've had very good success with it. I would say my success is in the 90 to 95 percentile. A lot of people are very happy with it. Now, what do I expect? I usually expect that when someone will get an injection, I'll usually expect to see them in 10 to 14 days for the second injection. And then usually I will get results in as few as 3 injections or as many as 6 or 8 injections. I have some chronically ill people who are very uncomfortable and have a lot of problems, and for those people they've required more than that, but that's not the norm. Now, with drawing up the solutions, you want to make sure that the laws in your area are met. Consult with your board and make sure that any of these solutions are acceptable for your use. I have 2 different options here, and I'm going to show you how I draw them up. The first one is one that's already pre-mixed by a good compounding pharmacy. The other one is individual nutrients. Now, when you're drawing up nutrients, you want to draw it up in a hood. And you also want to do that so that it gives you a sterility, a cleanliness that isn't acceptable in this environment. I'm going to take 2 cc's and I'm going to attach it. It just pushes and rotates. And then I'm going to push the 2 cc's in and then pull the 2 cc's out. Now, on the next bottle, I don't want to contaminate it with the first bottle. So I'm going to put 1 cc of the next bottle in. I'm going to pull this down to an extra cc of air so that I have extra space in there to prevent contamination. I'm going to attach this bottle. I'm going to pull down, then push up, so that way it cleans out any potential contamination. Take it off, and then I'm going to do the same thing with the next one. Pull an extra cc out, attach it, pull it down, add the cc, push in the gas, and then I can connect the next vial and do the exact same thing. Now again, you want to make sure you talk to your regulatory agency to make sure that this is something that you can do in your office. Usually it requires a hood. So what I'm doing is I'm finding my landmark, which is the patella, the kneecap. I'm drawing a line perpendicular from the kneecap, and there's a soft spot right in there. I'm going down 1 finger width or 1 thumb width, and my injection area is going to be right there. And now that I've got my landmarks, I'm going to clean all my landmarks off, and I'm going to inject. And I'm going to go at about a 30-degree angle, slides right into his knee. And there should be no discomfort once it's through the skin. And there should be, it should be very easy to push the fluid into the knee. Stabilize the needle, remove the first syringe, add a syringe of ozone. Now as I'm injecting, I want to just feel on the side, so I can feel the gas on the side of his kneecap. The joint capsule goes all the way over to here. And I can feel and hear bubbles in his joint. In knees, I can go anywhere from 5 to 20 cc's of ozone gas, depending on the knee, depending on the person. And he's a fairly healthy young man, and so he can handle all 20 cc's of ozone gas. I'm going to remove the needle, put it over there where it's safe, and then just move his knee passively to make sure that all the nutrients and gas goes around his knee. Well, you can do anything after this injection that is normal activities of daily living. So I wouldn't have you go skiing, I wouldn't have you go do some martial arts, but walking stairs is fine, doing normal daily activities is fine.